Much. If you've ever known somebody who's had one, you know, worst case, that strokes can be frightening, leaving a person helpless, unable to speak or move. And it's not just the elderly who are at risk. You might remember, of course, Vice President Joe Biden's 41-year-old son, Beau, is still in the hospital after he suffered a stroke. Fortunately, he is expected to make a full recovery. May is Stroke Awareness Month, and joining us this morning is Dr. Warren Levy with the Cardiovascular Group. Dr. Levy, thank you for being here.
Good morning.
I have to admit, I was really surprised that someone as young as Beau Biden suffered a stroke. It can occur in young people.
It can. As we discussed earlier, normally we think of strokes in the elderly, and we have an aging population, and therefore the incidence of stroke is increasing. But about 10 to 15% of strokes do occur in individuals under 45 years of age.
So can you describe, what is a stroke for people at home that may not know exactly what happens?
Well, essentially a stroke is when the blood supply to part of the brain is cut off, even temporarily, and part of the brain dies. Those cells die, and people are left with neurologic deficits. Sometimes it can be very subtle, like a personality change. Other times it can be very obvious, like an entire paralysis of half of the body. But the really important message in this month, which is Stroke Awareness Month, and it seems that each time we have an awareness month, like in Heart Awareness Month, we had the former president in the hospital, and now we have the vice president's son who just had a small stroke. It's important for people to understand the warning signs of stroke, and most importantly, what are the risks and what they can do about reducing their risks.
Well, let's run it down. Let's talk about what the warning signs are, first of all.
Okay, well, there's an acronym called FAST, F-A-S-T, and people need to understand how to identify someone who potentially has had a stroke. The first is F for face. If there's some facial asymmetry, or they can't smile, or their face looks lopsided, that could be the sign. A is for arms. Is there a weakness somewhere on one side of the body? Can they not hold their arms up? Or a leg, or any kind of a weakness on half of the body. S is for speech. Is there something wrong with their speech? Are they having trouble forming their words? Is their tongue not working? Are they having trouble understanding? And then T is the most important, because that's time. Time is of the essence. If someone's having symptoms of a stroke, even if you're not sure, they need to get to the hospital right away, because if we're going to treat them, we need to treat them within the first 4.5 hours if we're going to have any success.
You talked about Beau Biden and how there's a percentage of people in this country under 45 who are at risk of stroke. Talk about the risk factors. Okay. Who is most at risk?
When we talk about the risk factors, that's really going to address more the older population who are having strokes due to blockages that are developing in arteries that supply the blood to the brain. The major risk factors for stroke are cigarette smoking and high blood pressure. And those are two things that we can clearly do something about. People need to know their numbers. I talked about that when we talked about cholesterol and heart disease.
Right.
But you need to know your blood pressure, and if it's high, it needs to be treated. Cigarette smoking quadruples your risk of stroke. And then there are some heart rhythm abnormalities that are important called atrial fibrillation. And then you have all those other cardiovascular risk factors like high cholesterol, your genetics, sedentary lifestyle, obesity, and we do have an obesity epidemic in this country. But these are all things we can do something about. Your family history, your genetics, you're born with that, and you're stuck with it, but you can really work with all the others.
So in other words, maybe exercise, change your diet, get to the doctor, know what those numbers are, and basically take your health into your own hands.
Absolutely. We can reduce the risk of stroke and heart disease tremendously if people will just make an impact on some of these risk factors.
Dr. Levy, thank you so much. I think you've just brought us some life-saving tips and information this morning.
Well,
really appreciate it. We put that on our website too, myfoxdc.com. Back over to you.
Scary stuff. All right, Gavir, thank you so much.